Guys, welcome back to the Proactive Lifestyle Series. Last week we talked about the posture, how to kind of elongate the spine, widen the shoulders, and we talked a little about diaphragm and activation and breathing. Today I want to touch a little bit more on the diaphragm and how to properly breathe. Seems like kind of a weird concept, even a boring concept, but it can actually be extremely beneficial for everybody out there, whether it's back pain, neck pain, shoulder pain. There's so many things that it can help with. So I just kind of wanted to show you today how to practice that, because it can be kind of a frustrating concept because it's kind of hard to do. We're so used to doing the chest breathing, tightening the belly, that trying to get you to relax the belly and breathe through the diaphragm is actually a lot harder than you might think. So the best way to do it is to start laying down. When you're in the sitting position, it's very hard at first to kind of relax your belly for most people. So we'll go ahead and go on our back. As we're here on our back, the biggest thing, have the knees bent. That just helps take some pressure off the low back. We want to have a neutral neck, neutral chin. We don't really want the chin sticking out, or we want the head raised up. So again, try to be neutral as you can. Hands are going to go on the belly to start with. You will notice as soon as you go to breathe in, all the movement's here. So you're going to have a lot of movement here in the chest. You're going to have your hands on your belly, and you're not going to feel a whole lot happen. Okay, so what you want to see is when you breathe in, your hands should kind of get pushed up and away. Okay, so this at first, if you're holding any tension in the belly, you won't be able to do this. So again, like I said, relax, 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 relax. If you get that belly to relax, this will be much easier. So again, hands on the belly, breathe in, feel that expansion. Feel those hands go up toward the ceiling as you breathe in. Most people starting out are going to basically push their belly out as they breathe out. Okay, so that's the opposite of what we need to do. Think about when you breathe in, that air coming in is kind of pushing the belly out. Okay, so start here. Once you establish the belly breathing, you need to move on to a different zone of support. You want to go up to the rib cage, because the whole idea here is not just to push your belly out when you breathe, it's to do three-dimensional breathing. So the breathing, you should feel that all the way around the rib cage, in the back, in the front, and the sides. So it's easiest to start with the front, that's what the belly's for. Then we come to the sides. As you breathe in, the hands should kind of get pushed out and away. Okay, so still coming into the belly a little bit, but now actually we should feel some expansion out laterally here, out to the sides. Once you get that, pay attention to the back side. Are we still having the belly expansion? Are we still having the rib cage expansion? And now we should feel, kind of in my flank area, as I breathe in, I should feel pressure get created in the back side. This sometimes is the hardest spot to get the breathing to go to, but like anything, it just takes a little practice. And once you feel like you are good at getting the belly to rise, ribs to expand, getting the pressure in the flanks, so that three-dimensional breathing will take you to a sitting position. Most of us aren't laying down all day, so if we can practice, if we can learn this sitting up, it's going to be more helpful to us. So as we're sitting, most people are going to immediately see, if you were breathing through the belly and through the diaphragm laying down, most of the time you're going to come right up and you're immediately going to come back to the chest, because in a seated position, most people want to tighten their belly. They want to tighten that core, which we need to have more relaxation in the abdominal muscles to let the diaphragm do its job. So as we sit here again, try to relax your belly, and as we breathe in, it should expand again. So we should have the expansion here in the belly. Again, you're coming to the side of the ribs. You should feel that expand out, and then if I take my hands down the back side, from my flank area again, I should feel pressure there. This back here again is minimal. Like, you're not going to feel near as much as you do up in this front side. There won't be as much pressure created on this back side, but we have to have all zones covered to make sure we're getting that three-dimensional breathing. If you can practice this, this will help you a lot with headaches, neck pain, back pain. I mean, there's so many things that this will help with, and I know, like I said, it's kind of a boring concept, but you know, when you're sitting at work at your computer, start to pay attention to this. Even a lot of people who are standing on a factory line, they'll have a lot of low back pain or a lot of neck discomfort. I show them this, and it's a huge relief for them, and they're very surprised that, wow, breathing could help that much, and it does, because there's so many muscles involved here
that if we have bad mechanics, it'll really tighten things up for you. So try to practice this, work on this concept. Like I said, no, it's not the most fun thing to do in the world, but it will help you. So we'll touch base probably later on this week, more about some neck and shoulder discomforts, probably one of some headache things. So touch base with us then, but until then, practice your breathing.